Preeclampsia is when you have high blood pressure and possibly protein in your urine during pregnancy or after delivery. You may also have low clotting factors platelets in your blood or indicators of kidney or liver trouble. Preeclampsia generally happens after the 20th week of pregnancy. However, in some cases it occurs earlier, or after delivery. Eclampsia is a severe progression of preeclampsia. With this condition, high blood pressure results in seizures. Like preeclampsia, eclampsia occurs during pregnancy or, rarely, after delivery. Approximately 5% of all pregnant women get preeclampsia. Causes. The exact cause of preeclampsia involves several factors. Experts believe it begins in the placenta, the organ that nourishes the fetus throughout pregnancy. Early in pregnancy, new blood vessels develop and evolve to efficiently send blood to the placenta. In women with preeclampsia, these blood vessels don't seem to develop or function properly. They're narrower than normal blood vessels and react differently to hormonal signaling, which limits the amount of blood that can flow through them. Causes of this abnormal development may include insufficient blood flow to the uterus, damage to the blood vessels, a problem with the immune system, certain genes, other high blood pressure disorders during pregnancy. Preeclampsia is classified as one of 4 high blood pressure disorders that can occur during pregnancy. The other 3 are gestational hypertension. Women with gestational hypertension have high blood pressure but no excess protein in their urine or other signs of organ damage. Some women with gestational hypertension eventually develop preeclampsia. Chronic hypertension. Chronic hypertension is high blood pressure that was present before pregnancy or that occurs before 20 weeks of pregnancy. But because high blood pressure usually doesn't have symptoms, it may be hard to determine when it began. Chronic hypertension with superimposed preeclampsia. This condition occurs in women who have been diagnosed with chronic high blood pressure before pregnancy but then develop worsening high blood pressure and protein in the urine or other health complications during pregnancy. Risk factors. Preeclampsia develops only as a complication of pregnancy. Risk factors include history of preeclampsia. A personal or family history of preeclampsia significantly raises your risk of preeclampsia. Chronic hypertension. If you already have chronic hypertension, you have a higher risk of developing preeclampsia. First pregnancy. The risk of developing preeclampsia is highest during your first pregnancy. New paternity. Each pregnancy with a new partner increases the risk of preeclampsia more than does a second or third pregnancy with the same partner. Age. The risk of preeclampsia is higher for very young pregnant women as well as pregnant women older than 40. Race. Black women have a higher risk of developing preeclampsia than women of other races. Obesity. The risk of preeclampsia is higher if you're obese. Multiple pregnancy. Preeclampsia is more common in women who are carrying twins, triplets or other multiples. Interval between pregnancies. Having babies less than 2 years or more than 10 years apart leads to a higher risk of preeclampsia. History of certain conditions. Having certain conditions before you become pregnant, such as chronic high blood pressure, migraines, type 1 or type 2 diabetes, kidney disease, a tendency to develop blood clots, or lupus, increases your risk of preeclampsia. In vitro fertilization. Your risk of preeclampsia is increased if your baby was conceived with in vitro fertilization. Complications. The more severe your preeclampsia and the earlier it occurs in your pregnancy, the greater the risks for you and your baby. Preeclampsia may require induced labor and delivery. Delivery by cesarean delivery (C-section) may be necessary if there are clinical or obstetric conditions that require a speedy delivery. Otherwise, your doctor may recommend a scheduled vaginal delivery. Your obstetric provider will talk with you about what type of delivery is right for your condition. Complications of preeclampsia may include fetal growth restriction. Preeclampsia affects the arteries carrying blood to the placenta. If the placenta doesn't get enough blood, your baby may receive inadequate blood and oxygen and fewer nutrients. This can lead to slow growth known as fetal growth restriction, low birth weight or preterm birth. Preterm birth. If you have preeclampsia with severe features, you may need to be delivered early, to save the life of you and your baby. Prematurity can lead to breathing and other problems for your baby. Your health care provider will help you understand when is the ideal time for your delivery. Placental abruption. Preeclampsia increases your risk of placental abruption, a condition in which the placenta separates from the inner wall of your uterus before delivery. Severe abruption can cause heavy bleeding, which can be life-threatening for both you and your baby. HELP syndrome. HELP, which stands for hemolysis, the destruction of red blood cells, elevated liver enzymes and low platelet count, syndrome is a more severe form of preeclampsia, and can rapidly become life-threatening for both you and your baby. Symptoms of HELP syndrome include nausea and vomiting, headache, and upper right abdominal pain. HELP syndrome is particularly dangerous because it represents damage to several organ systems. On occasion, it may develop suddenly, even before high blood pressure is detected, or it may develop without any symptoms at all. Eclampsia. When preeclampsia isn't controlled, eclampsia, which is essentially preeclampsia plus seizures, can develop. It is very difficult to predict which patients will have preeclampsia that is severe enough to result in eclampsia. Often, there are no symptoms or warning signs to predict eclampsia. Because eclampsia can have serious consequences for both mom and baby, delivery becomes necessary, regardless of how far along the pregnancy is. Other organ damage. Preeclampsia may result in damage to the kidneys, liver, lung, heart, or eyes, and may cause a stroke or other brain injury. The amount of injury to other organs depends on the severity of preeclampsia. Cardiovascular disease. Having preeclampsia may increase your risk of future heart and blood vessel cardiovascular disease. The risk is even greater if you've had preeclampsia more than once or you've had a preterm delivery. To minimize this risk, after delivery try to maintain your ideal weight, eat a variety of fruits and vegetables, exercise regularly, and don't smoke. What are the symptoms? Mild preeclampsia, high blood pressure, water retention, and protein in the urine. Severe preeclampsia, headaches, blurred vision, inability to tolerate bright light, fatigue, nausea, vomiting, urinating small amounts, pain in the upper right abdomen, shortness of breath, and tendency to bruise easily. Contact your doctor immediately if you experience blurred vision, severe headaches, abdominal pain, and/or urinating very infrequently. How do I know if I have preeclampsia? At each prenatal checkup, your healthcare provider will check your blood pressure, urine levels, and may order blood tests which may show if you have preeclampsia. Your physician may also perform other tests that include checking kidney and blood clotting functions, ultrasound scan to check your baby's growth, and Doppler scan to measure the efficiency of blood flow to the placenta. How is it treated? Treatment depends on how close you are to your due date. If you are close to your due date, and the baby is developed enough, your health care provider will probably want to deliver your baby as soon as possible. If you have a mild case and your baby has not reached full development, your doctor will probably recommend you do the following: rest, lying on your left side to take the weight of the baby off your major blood vessels. Increase prenatal checkups. Consume less salt, drink at least 8 glasses of water a day. Change your diet to include more protein. If you have a severe case, your doctor may try to treat you with blood pressure medication until you are far enough along to deliver safely, along with possibly bed rest, dietary changes, and supplements. How can preeclampsia affect the mother? If preeclampsia is not treated quickly and properly, it can lead to serious complications for the mother, such as liver or renal failure and future cardiovascular issues. It may also lead to the following life-threatening conditions: eclampsia. This is a severe form of preeclampsia that leads to seizures in the mother. HELP syndrome, hemolysis, elevated liver enzymes, and low platelet count. This is a condition usually occurring late in pregnancy that affects the breakdown of red blood cells, how the blood clots, and liver function for the pregnant woman. How does preeclampsia affect my baby? Preeclampsia can prevent the placenta from getting enough blood. If the placenta doesn't get enough blood, your baby gets less oxygen and food. This can result in low birth weight. Most women still can deliver a healthy baby if preeclampsia is detected early and treated with regular prenatal care. How can I prevent preeclampsia? Currently, there is no sure way to prevent preeclampsia. Some contributing factors to high blood pressure can be controlled and some can't. Follow your doctor's instruction about diet and exercise. Use little or no added salt in your meals. Drink 6 to 8 glasses of water a day. Don't eat a lot of fried foods and junk food. Get enough rest. Exercise regularly. Elevate your feet several times during the day. Avoid drinking alcohol. Avoid beverages containing caffeine. Your doctor may suggest you take the prescribed medicine and additional supplements.